Hi, my name is Connie Koklanis and you're watching Orbital Injuries, Effects of Trauma. In this video, I just want to revisit what happens when an orbital injury occurs so that when we go to blowout fractures within this module, you'll have a clear understanding of what has happened or the mechanism by which we have restrictive strabismus in orbital injuries. So I mentioned earlier that trauma to the orbit can cause either soft tissue injuries or blowout fractures. The focus of this inquiry or this module within this inquiry will be on blowout fractures. But in having an orbital injury, soft tissue injuries also occur where we will have edema and hemorrhage. And this can in itself create a mechanical restriction and double vision. And it can be one of two things. It can either be the swelling and the edema that's causing the restriction of eye movement, or it can be scar tissue secondary to soft tissue injury that can cause the mechanical restriction. And to the right here, we have a young boy who we can see has had an orbital injury to the right eye, and we have the eye closed from the swelling there. The other thing that can happen is a blowout fracture, in which case the orbital bones are affected by the injury. A blowout fracture, in essence, is a fracture of one of the orbital bones and will occur when a force or impact hits the eye or the soft tissues around the eye. So it's often caused by a blunt, non-penetrating object. So we're looking at things like a ball or a fist. And it generally happens when the object is larger than the diameter of the orbital margin. And we can see here in the image to the right that the ball is larger than the orbital margin. In terms of the causes of blowout fractures, there are a number of reasons why a patient might sustain a fracture of one or more of the walls of the orbit. And here is a list of the more common reasons a patient might present to emergency or to your clinic with a possibility of a blowout fracture. So we have, at the top there, we have motor vehicle accidents, we have falls, assault, and in particular with assaults, fists versus eye or knee versus eye tend to cause fractures. And then we have sporting injuries, so where a ball hits the eye, or it could be an object such as a hockey stick hitting the eye, etc. Now, what is the mechanism by which the bones end up fractured? There's two theories, the buckling and the hydraulic theory. In the buckling theory, we have direct trauma to the orbital rim, which is transmitted through like a ripple effect to the walls. And this results in the walls fracturing. The hydraulic theory, on the other hand, indicates that the trauma causes an increased orbital pressure that then results in the weakest bones within the orbit fracturing. So in summary, soft tissue injury and orbital fractures can occur from trauma. And where it's an orbital bone fracture, the mechanisms that we consider to cause the fracturing of the orbital wall or walls, in some instances it can be multiple, is the buckling and the hydraulic mechanism. The next several videos in this series will now focus on blowout fractures in particular, as well as soft tissue injury to some extent, but talking about the classification of blowout fractures, talking about clinical characteristics, and also the management of these patients. Okay, that brings us to the conclusion of this video. Thank you for watching.